Good day! I am Dr. Wilfredo S. Tagle, urologist, and welcome to Medical PracTIPS. It is a series of tips and tricks that would help you your medical practice. For today's episode, we will be talking about bedside manners. Doctor's rounds. It is the most anticipated event of the patients every day. Talagang hinihintay niya lagi ang doctor's round. It is important that you visit your patient at least once a day or, if possible, as often as you can. Then, the first thing to do with making rounds is ensure that you properly know and dress up properly for the rounds. Identify yourself. Make sure that you are wearing a clean and professional attire. Whenever you visit your patient, feel good. Dapat professional ang dating. Okay? Next, before going to their room, visit your patient's case. Look at the chart. Examine what are the updates. Make sure that you know the name of the patient, their complaints, current status of the patient, diagnosis, medications, and your plan for the patient for the next few days. Once you reach your room, be sure to knock the door. Always knock before you enter the door of the patient. While walking in, enter the room calmly. Huwag yung natataranta ka. And confident manner. Do not show that you are in a hurry. Huwag nagmamadali. Give them the proper time for that ever-expected event. Greet them properly and address them with their first name. Like, hello, Mr. John. And their last name, Mr. John Porontong or John Paredes. Okay. Introduce yourself. I am Dr. Wilfredo Tagle, your urologist. And with me is my resident, Dr. Tan, my interns, my clerks, and our nurse for the day. If you make rounds with your secretary, you also introduce your secretary. Make sure that you always maintain a good eye contact. While talking to your patient, try to sit down at their bedside para kita nila na hindi ka nagmamadali and relax ka. There are studies that when you sit down beside your patients, they would feel that you have spent a precious moment with them. Doing this can make the impression that you can give your patient adequate time for their discussion. Then, try to examine your patients and extend a personal touch. Iba yung hinahawakan sila. Hinahawakan sa kamay, hinahawakan sa paa, hinahawakan sa noo para lang ma-feel nila that they are being taken care of. Always give a chance to your patient to speak and explain their current condition. But going back to touching, be sure that you touch the proper area of your body and always bring somebody with you. Okay, you have to understand that your patients are not feeling well. Mainit ang ulo niyan. That's why it is important that your patients give them their comfort. And by touching them, it is a very comfortable time for them. Then, discuss to your patients, to the bantay or relatives, about the updates of the patient, their present vital signs, the new laboratory results, the medications, and your future plan. What to expect for the next few days. But remember to avoid using technical medical terms or jargons because they might not understand you. Explain them in layman's term as much as possible in their vernacular language. Before leaving the room, ask your patient if they have other questions or requests. Are you comfortable? Do you want more cooler aircon? Or do you want an extra bed? Do you want your food? How did your food taste? Let them know what to expect regarding medications for future procedures. Okay? Tell them that the nurse will be giving you some medications for tonight before going to bed. And if possible, tell them when will be your next visit. Okay? But most of all, try to end your conversation on a positive note. Give them the hope that they will feel well and comfortable with a better quality of life. So that's it for today. Tune in every Wednesday, 7 p.m. for Medical PracTIPS. Bye-bye!